Much, Sophie. Thank you, everybody, for joining us today on the final part of Winning the Healthcare War. Today, we're going to be focused on engaging and keeping the right talent. So, for those of you that weren't on some of the earlier webinars, I'll do a really quick high-level overview, and for those of you that were, just to give you a refresher and a reminder, because really it all works together, this winning this talent war and really hiring and retaining the right people all starts with being able to attract the right people and being able to attract the right talent for our organization. We have to recognize that work really has changed. The types of people that we're hiring, they're all different ages. We have, multiple generations in the workplace, but beyond that, the impact of technology and social media and all of these other pieces on how people process and look for jobs and stay in jobs has changed. What we do has changed. We have become much more technical in all of our roles, and so even things like in healthcare has moved definitely more towards computer and tech focus. Where we work has also changed. We have mobile. A lot of us are working in multi-locations or multi-facilities. It isn't simply one location as it used to be years ago. When, we run 24 hours a day, 7 days a week, holidays, weekends, it just doesn't stop. And even when we're off work, we're often still connected thanks to our iPhones. And how we work has changed. Again, that uber connectivity of people is just different than it ever has been at any point in history. Hospital job growth itself is also suddenly surging. After nearly a decade of pretty level growth month over month and year over year, we really saw in the fall, September, October, November of 14, something really shifted and turned. And by January of 15, we've seen a really surge and spike in month over month growth that doesn't seem to be leveling off. With that, staffing shortages have become a top concern of healthcare executives. 42% of executives feel shortages of staff is a larger issue than any of the healthcare reform issues for the first time in years. 72% of those same executives report the supply of primary care physicians is inadequate to meet their needs over the next 3 years. For those of you that are recruiters on this call, you're like, yeah, of course, I know. And 51% of these same healthcare executives say they don't have enough healthcare extenders, such as the nurse practitioners and physician assistants, to be able to meet the needs and demands over the next couple of years. We also talked about employment branding and the link of, if we want to have those qualified applicants, having and the ability to attract the right people in and really appealing to them is key. And that strong employment brands drive 2 times as many qualified applicants and also leads to a 50% decrease in cost per hire in times when we're really having to watch those budgets a little bit more. And just as that wrap up, and the reason is the shift has changed. It's no longer that you just go into a hospital or go into a healthcare system and you apply for a job and you wait to get your job. People have made job searching really social. They're asking around for options. They're checking out websites. They're checking out Glassdoor. They want to know what it's going to be like to work somewhere before they work there. In part 2 of the series, the second webinar, we talked about hiring the right people. So you've gone through the efforts of building this brand and engaging them and having a strong brand awareness out there. But how do you actually go through the process of hiring them to come on board? Well, first, to start it off with kind of the continuation of your career site and making sure that your online application is really simple, mobile ready, effective. 48% of candidates are going to drop out of the application process before they even finish applying. That number is almost 70 if you have a complex application or if you are not allowing them to just complete it all in a mobile-friendly way. And it's also not addressing what candidates are actually looking for. And so what candidates really want early on, and this flows into what our employees want for today's focus, but if they want to have an idea of the culture and the values that your organization has. They want to understand the process your organization uses to hire, have an easy way to apply for a role, especially via those mobile devices, and get some feedback, something as simple as an automated email response that says, "Thank you for applying. We appreciate it. We'll reach out if we're a good fit." And then overall, just like our employees, just like our patients, just like people in our own families at home, what they really just want is to simply feel like somebody cared. It's also looking at the desires of the new workforce, and are we talking, as we go through this hiring process and interview process, are we really talking about what people care about, which is the flexible hours, especially with nursing and on-the-floor type of roles, training and development, and giving them opportunity to cross-train in other areas. Are you giving the discussion during the interview process that's going to make them want to stay and retain long-term? And then specifically the interview process and who you include in there and how that impacts employee engagement, team morale, and really today's focus is on that retention and engagement piece. So how do we engage and retain the talent we hire? It's really been a challenge for organizations, and again, starting at the beginning and understanding that a strong employer brand can lead to a 28% increase in retention, because employees today are bombarded with advertising. We get it everywhere we turn. Every app we download has advertising. There's advertising on our commercials. We buy Hulu and Netflix. We don't have to have advertising, and they still have advertising. There is something about branding that has completely inundated us that makes us now feel that we need this in the workplace. And so a strong retention program has to start at the beginning. And when we look at healthcare and an area that has really one of the highest turnover rates, we're at 17%, there has been a leveling off of registered nurses over the last couple of years, but we're still a pretty consistently high turnover rate. One of the things we have to look at are our engagement strategies and how do we connect the dots here. Most engagement strategies look something like this. 1, we hire somebody. 2, we tell them to be happy. 3, we start to reward and engage, typically too late after the worker isn't happy. 4, the person leaves. Company's mad, they're shocked, they don't understand what happened. So they go on, they hire somebody new, and they repeat this exact same process over and over. Our engagement strategies really have not evolved all that much. We know, though, that with recruiting, if we move that engagement strategy and we shift that conversation around turnover and retention earlier in the process to the recruiting, we know it has a direct impact. Burson is an analyst firm that focuses and specializes in researching human capital and human resources. They are now part of Deloitte. And they have 4 levels of talent acquisition maturity, where a level 1 is an organization definitely is very reactive, tactical. Somebody quit, I post a role, I fill that role, that's it. It's a very one-for-one type of process. Standardized operational means you might have consistent job postings, you might have some consistency in the process, but it still isn't really connected or tied back into performance and talent management, and definitely not tied back into the more strategic approach. Level 3 is where we start integrating and we see talent acquisition tied together with onboarding and a little bit with succession planning and starting to look much more strategically about building pipelines of talent and where we're going to need people in the future, so when there is an opening, we can reduce the time. And then level 4 is really that optimized. It is a very strategic partnership between talent acquisition, talent management, core HR, and really understanding what's going on within the business. Most organizations fit somewhere between level 1 and 3. 2.5, 2 plus is probably really the most common for organizations that we see. And in healthcare, I would say definitely the level 2 is a little bit more what we see. Interestingly, though, children's hospital systems tend to be a little bit more advanced with a much more integrated talent acquisition approach. But what the Burson research showed us is that the more mature and strategic your recruiting process is, the lower your turnover rate is. And imagine if you could drop your turnover rate by 5 to 7% simply by creating a more uniform and a little bit more of a strategic approach to hiring. So where do you start, right? All of this is great in theory, but what can we actually do and how do we actually start, and what are some concrete examples of how you can do this within your own organization? And as you have questions, if you happen to have questions as we're going through, please feel free to send them over in the Q&A section. If it makes sense, we'll address it as it comes through, and if not, we'll definitely have some time at the end to do it. I definitely encourage you to send over some questions that are specific to your own organization on this topic. The first area to really start with is to address the executive disconnect. On average, hospitals are losing, or the average hospital loses somewhere between 4 and 6 million annually due to turnover. That may not be a direct cost per hire to do replacements, but sometimes it's the cost in training. It's the cost in decreased patient satisfaction. It's the cost in lost revenue or overtime of other people having to step up and fill open positions. It is a huge expense for organizations. At the executive level, almost every company says retention is a key strategic operative for 2016 and 2017. And yet, only about half of companies have formal retention plans in place. And so a really great place to start is just to see if you even have a formal retention plan and what does it look like? How is it set up? Does it make sense? And was it really created in the last year to 3 years? Or is it something really for a more formal, traditional type of workforce than what you're actually seeing today? When we're building these engagement and retention plans, there's kind of 5 steps going through the process that really seem to make sense. Again, it's recognizing that they start before day 1, before that person is even hired, is already impacting their retention and what it's going to be like for them when they come on board. So step 1 is to build that talent brand authentic to your culture. Step 2 is to make sure you have a story. You could talk the values, and that messaging is being carried through every person in the organization that anybody comes in contact with. And beyond just from a recruiting perspective, as we'll talk a little bit further in the referrals, making sure that people understand that story throughout the entire organization is key. The third part of that plan is to support the story and engage through onboarding and make sure that when you're doing the onboarding process and you're doing orientation and you're giving people the first couple of days of being on site, that they have some of these opportunities. Step 4 is making sure that you're developing engagement through management, and there is conversations on performance and what is working and what isn't working, and there's engagement on an ongoing, regular basis outside of just simply that performance review. And finally, just communicating regularly throughout the organization the goals, the changes, the advancement, and what is happening over and over so people feel connected. less than 40% of your workforce even knows what the bigger goals of your company are. And we work to try to achieve and to try to strive to meet these goals. And so it's okay to start really small. You don't have to put a whole plan in place from day one. It's okay to start and just figure out where there are some tweaks and things that you can do and work from there. It's important to kind of take a look and really discern value of what you already have. I am not a huge proponent of kind of the rip and replace philosophy, and because it seems very disruptive for me. And look at what is working and what isn't working. Just because 80% of it isn't working doesn't mean we can't work with the 20% and build a really strategic engagement strategy and retention strategy off of that. Doing a quick survey of stakeholders, and your stakeholders are your managers, your executive team, your patients, your current employees, your applicants that are coming through. Understand what they're looking for, and for Cornerstone clients, if you happen to be at Convergence, you heard we have the new survey and engagement information that's going to be coming out and give you access to be able to do this much easily within your system. But next, has there been an improvement in the efficiency or the effectiveness of related human resource programs? So what else have you done throughout the organization, and how can you piggyback off of those? Again, it doesn't have to be starting from scratch. And then continue just to review and edit that until you get going. One of the first areas that impacts retention, engagement, and turnover is onboarding. It really starts as soon as that offer is extended and that person is hired, and it continues through their first 30, 60, 90 days, depending on the organization. 98% of executives say onboarding programs are a key factor in retention efforts. It's something that we sometimes take for granted. We turn it into a lot more of an orientation. We don't make it a two-way experience, and we don't really think about it beyond just making sure somebody can get in the job as fast as possible. Let's get these forms filled out. How do we get you on the floor? Let's do this, versus really taking the time to step back and understanding that a formal onboarding program is going to have a direct impact on your retention rates a year from now, 3 years from now, 6 years from now. So what does a strategic onboarding process look like for your organization? It really varies with the company and the role. Some companies have a lot more luxury of doing very long onboarding processes. Most healthcare organizations, they just don't have that luxury. And so I will say it does need to be longer than a day and really even longer than a week, but that doesn't mean it has to be exclusive and that's all they're doing for that period of time. It really does start the second that the offer is extended and should have some milestones and some goals or check-ins at that 30, 60, 90 day. How's it going? What are you missing? What should we be doing differently? How can we improve this? How do we make this comfortable for you? Just, again, a reminder, just like as a candidate wants to have in the upfront candidate experience, a new hire just wants to know that somebody cares. If they're feeling unhappy, if they're feeling like it's not what they signed up for, they're going to quit. And so having those check-in points really does reduce some of these issues. Second, having a strategic or formal onboarding process makes it consistent so everybody that comes in has the same experience. You make it special. You make it an important part of becoming an employee at your organization. It also allows people to come in and be set up for success day one. It's also participatory. It isn't simply orientation. Yes, we're going to talk about compliance. There are forms that have to be filled out, company policies that have to be reviewed, but it also has to be on culturalization and really getting connected to the culture. It's selling the story of the values, your goals, why you're even doing what you're doing, what the history is of the location of the organization, what the big picture, what you want to do to change your little corner of the world. Next is socialization. So it's connecting people to other people, learning what the internal slang is. What are the different departments? What do you call the units? Do you have words for certain people in certain roles that are unique to your organization? Are things color-coded versus named? You know, what is it unique about your organization that if they know coming in, it's going to make them feel kind of part of it versus an outsider looking in? And then talk a little bit about your strategic talent management goals. What type of opportunities do you have for learning? Are there training opportunities ongoing? Future growth planning? Do you do cross-training from one department to another? Do people have the opportunity to join a floating pool for nurses or CNAs where they can fill in and float into different areas to help advance and grow their skills? All of these things are really key to be talked about during the onboarding process. Employees and new hires are 58% more likely to be with your company or your organization 3 years later if they participated in a formal onboarding program up front. There's a very clear link between this from a retention perspective. The next part I want to talk about is referral programs. And we've all heard about referral programs, and some companies do different unique type of things, but referral programs really are key, and they're becoming more and more important because people want to feel like they socially fit in, and they want to work with people that they know, that they like, that they're friends. They also want to feel like they work at a place that's so cool that they want their friends to work at also. Referral programs are directly tied to employment brand. Companies that have a bad employment brand and have low employee satisfaction scores typically have very low referral program scores as well because they don't want their friends to come work here. What ends up happening with lower employee referral programs and kind of poor branding is you actually end up spending more, on average 10% more per hire. And the reason being is because it costs more to hire somebody, but people actually will often take less of a pay increase when they're coming in as a referral because they feel like they have an inside track or a better understanding of what it's actually like to work at an organization versus a cold candidate or somebody that's coming in. Referrals also have a much bigger impact once they come through the door. They have a 25% more profit impact than hires from other sources. If they're a referral from a top performer, they're going to produce nearly 3x profit impact and a 90% greater profit impact than a standard referrer. And they're also 30% less likely to quit than workers that were hired from any other source. So again, that connection with retention comes directly back. When we talk about it from a healthcare perspective, it isn't always profit that we're looking at. But what we do look at is patient satisfaction scores, and we see the very similar type of correlation between patient satisfaction and the referrals as we do on the corporate side with profit. Another area that is really key, along with the referrals and onboarding, is your internal mobility, or what you also will hear referred to as re-recruiting. Are you creating opportunity for people inside your organization, your healthcare system, to take on other roles? Or do you have a culture that really doesn't support that? Most people leave and take new roles because they want other opportunities. They want more advancements. They want a company that has a better reputation that they feel is going to treat them better. 84% of workers, in fact, would consider leaving their job for a company with a strong reputation. That ties back into the employment brand, but it also ties back into the importance of re-recruiting and having a real focus on succession planning and internal mobility with your workforce. When we hire people, a lot of times we just take for granted that they're just going to stay with us long term. And when we're in a really competitive space like healthcare, it becomes even more vital to take on this understanding of needing to re-recruit and re-market and brand the same way we are to our competitors and to the marketplace in general. We have to continue to do that internally. So the number one reason why people left, if we look at this as a global average, is that they're concerned about the lack of opportunities for advancement. Second, and very closely, is unsatisfied with leadership of senior management, unsatisfied with the work environment or culture, looking for something more challenging. At the bottom really is unsatisfied with the rewards and recognition for my contributions. That's not to say that you shouldn't do that, so please don't take that at all for this. But really, we have to understand why people are leaving if we want to retain them. And we have to understand why internal mobility is so important for us when we're in a very highly competitive work environment that often doesn't have the cash flow to just throw additional cash and compensate retention. The lack of opportunities for advancement is sometimes misconstrued when I'm going in and I'm talking to leadership teams. They say, well, not everybody can be a manager, or not everybody can be a team lead, or not everybody can be a charge nurse or in charge of a unit. Not everybody can be in charge. And we have to have the conversation, and as HR professionals and leaders in talent management, so much of our role now is that of coach and educator, and really helping our senior leadership team and our executive team understand what this new face of talent looks like and what this new face of expectations are, where it isn't a career ladder as much as it is that career lattice you hear about it and people kind of moving around. When they talk about lack of opportunities for advancement, it often just simply means the chance to learn new skills and to work in different departments and to extend their learning, extend their understanding, and extend their knowledge base as much or more as it means getting a promotion to that next level. And so it's really important that we are conversating and building a strategy that falls in line with what the employees are really expecting, not with what we think that they are expecting. The leadership and the unsatisfaction or dissatisfaction of leadership sometimes is really tightly put in there, where they are not feeling like they're getting opportunity to learn and to grow. And we see this sometimes in healthcare with RNs that go back and complete their BSN, for instance, and even after completing that next level of education, are not, whether it's compensated, they're not given the opportunity for advancement. Their senior leadership doesn't kind of see that as enough for them to move in, and so they switch to other locations because they're going to get hired not based on a perception somebody has, but based on their actual skills and abilities. The next step, I'm going to go back here really quick. Somebody asked for the source of the survey, and I just realized for some reason the source of this was cut off. I will try to find that information and make sure that the source of this comes out to you guys. So the next step that has come through is the engagement survey. We know a lot about doing employee satisfaction surveys and how happy they are, but just because somebody is satisfied doesn't mean they're engaged. And just because somebody is engaged doesn't mean they're satisfied. And we have to stop the conversation of putting these as they are the same. There's research on corporate side that talks a lot about that sometimes your highest performers are your least satisfied workers. And there isn't always these correlations that are nice and pretty in a perfect bow that seem like they should be. It really is a lot more challenging than that. Some people, are happy, they're fine, but they're not really engaged because they don't feel like they have a reason to care. They don't know what the goals are. They don't have a mission for it. They don't think anybody cares about them, so they don't feel like they're going to care back. The number one variable, Gallup did a research last year, and they looked at more than 200 major hospital systems throughout North America. And the number one variable correlating to patient mortality rate was actually the nurse's engagement level. More than how many patients a nurse was trying to manage, more than location, more than anything else, it came down to engagement level. When people are engaged, they do just a little bit more. And so if you have a hard time thinking like, well, how would I know if our company is, if our employees are even engaged? It's little stuff. So it's your food service workers always making sure the trays are consistent and look nice and that the food is getting delivered while it's still hot. And it's not, we'll sit and chat here for a little bit because who cares about if the food is hot or if it's not hot. It's the people that do registration and check people in if they genuinely seem to have concern and care, or if they're just watching the clock to get to their next break. It is the nurses and the nurse practitioners and the doctors. Are they taking the time to just ask that one more question that could make all of the difference in that person's experience at the facility? Satisfaction and engagement are definitely very different things. I always tell a story about one of my first jobs out of college. I had the opportunity to work at a company, and one of the departments really struggled, and they had really high satisfaction rates, but really low performance and really low engagement. Like they really didn't do anything. And I was tasked with going in and trying to understand where this disconnect and everything was. And, somebody finally shared with me, well, yeah, we love our job. Like we don't do anything. So there, for a long time, nobody looked past that satisfaction number, and they were so content with the satisfaction number. But when it came down to it, we found out the department was on average taking between 2 and 3 hours a day of breaks in an 8-hour day. So they were incredibly satisfied. They were ordering lunch. They were doing all of these other things as a department because the culture of that department just was totally disengaged from working. It just had become something else. And, at its core, people want to care about things. Everybody on this call, all of the people we work with, everybody we cross in every grocery store, every airline, every restaurant we go to, they're all just simply people that want to care about things, and they do care about things. They're caring about their kids, sports, brands, hobbies, travel, cars. They care about their friends. They care about their coworkers, their clients, their patients, and they care about their career. The desire and the need to care about other stuff meets a basic human need. And so really understanding that from an engagement perspective, how much do they really care about these people around them really is key, and especially in a healthcare environment where your patient satisfaction scores are so closely tied into everything else. At work, though, we like to pretend that people are only focused on one thing. And so you come to work, you're supposed to block everything else out of your mind, but the reality is we're still thinking about everything else that's going on throughout the day. Where did we put our coffee? What are my kids doing right now? Or did I remember to turn off the light? Oh man, I have a bunch of meetings I have to get to, plus I have this other thing to do. And then they're starting to think about, I did a great job. Did nobody notice? Wait, maybe they noticed and they just didn't say anything. All of these things impact engagement, these little tiny nuances that happen throughout the day. I wish somebody would listen to me about this patient, about this client, really giving autonomy and power. If somebody hears or sees something with somebody, whether it's a client or a patient or a family member, do they have the ability to go tell somebody else, or is there a hierarchy of who's allowed to kind of share that information? So just to kind of wrap up and kind of roll this all in together about retention, our retention focus as we look at engagement scores and internal mobility and all of these other pieces are often so closely tied to performance and performance scores. We know highly engaged workers get feedback on their performance at least weekly. Less than 20% of low engagement workers do. And so from a performance perspective, it's no longer about that annual performance review, which is important and key to do. And please, this is not a, give up your annual performance review, but it's making it bigger than that. It's doing these pulse surveys. It's doing this true engagement and reach out on a very regular basis. It's making sure that whoever that the lead or supervisor or director is just checking in and say, hey, I heard you did X, Y, Z. That's great. Thank you. And just showing appreciation, acknowledging what they're doing. And sometimes it's not even all positive. It's just helping them be aware. Hey, this was a really tough situation here. Here's maybe how we could have handled it differently next time. Thanks. Thanks for listening. Thanks for going to do better next time, whatever the case is. But performance and the conversation and the engagement piece of feedback is really key for engagement and retention. But I want to make sure that we remember onboarding. Most new hires are going to decide within the first 30 days how long they're going to stay at your organization. The first 6 months for most healthcare companies is when you see the most turnover. In fact, some healthcare companies that I have done work with over the last year have told me that they have their highest level of turnover within the first 48 hours on the job after they get through orientation, which typically we know and we see and learn comes from expectations being disaligned in the recruiting and onboarding process to what the job was actually going to be like. And then recruiting, making sure they understand the strategy, they understand the bigger picture, and they understand what that role really is. Not all jobs are glamorous. There's some jobs that look a lot cooler on Instagram. There's other jobs that look, great, as we're highlighting our day on Facebook later. But at its core, nobody has a glamorous, amazing job. And so when we only tell people about the kind of the pretty parts of our job when we're going through the interview process, it impacts the retention at the back end. So here's just kind of a wrap-up slide focused on talent retention, and then we're going to open it up for some Q&A, and definitely happy to answer any specifics on whether it's retention or any of the 3 sessions that we talked about, a talent attraction, interviewing, hiring, or retention. But here's just kind of an at a glance, right? If you want to focus on talent retention, the first is how do you retain talent? Finding who's vulnerable to attrition, watch trends with certain roles, departments, leaders, see where there are issues or where there isn't. See where there's those anomalies. Again, it's going back to, this department has really high satisfaction rates, but they're not doing anything, right? Finding those anomalies within your organization. Second is focusing on internal referrals, making it incredibly easy for people to refer somebody else. I've seen in organizations where in order to refer, you have to have that person's resume and all of their credential information and, their this and that and all of this information. Make it simple. You want people to be able to refer somebody over and walk away, hand it off. Because the more referrals you get, the higher your engagement, the lower your cost per hire. And there's all sorts of ways to do this if you are unable to pay for every referral that gets hired because of budget restraints or other issues at your organization. I've seen some really creative programs where people give away 4 hours of PTO, or some organizations do a 1-week all expense paid vacation. So everybody who did a referral through the year gets their name in a bucket and their name gets drawn and one person wins it. The company ends up spending about $2,000 on a 5-night all-inclusive trip and 5 days of PTO time. In exchange, they got how many of these hires throughout the year? Next is hypo identification, and this is really identifying the people that are going to be at risk, getting succession planning in place. If you don't have succession planning, I cannot advocate for career pathing and succession planning enough within organizations. It's really in key. Identifying those high potential workers, making sure they're getting ongoing training, make sure they're identified and given some skills opportunities. And then creating fans, understanding why people leave, who's successful, making sure your HR departments, your talent management departments are partnering with talent acquisition to make sure you're getting the right people in the door to start with. And so with that, we're going to move over into some of the Q&A. We have about 10 or 15 minutes. There's a couple of questions here, but definitely please continue to send through your questions. So the first question up is, there are many formulas and some are extremely cumbersome for measuring turnover costs. What is the industry standard for the healthcare industry? I wish I could tell you that. The reality is measuring turnover costs, there is no industry standard in any industry, so it's not just a healthcare industry. Companies come up with a standardized formula in a couple of different ways, and it typically has to do with the amount of data and analytics that they have that is valid and at their disposal. And so a couple of the factors that I typically will see somebody look at for measuring turnover costs is the cost per hire, which I find is one of the least valid metrics overall that an organization can do, because we'd have to factor in the cost of employment branding, and the cost of the interview teams. And I'm not sure that's a metric that we often calculate correctly, but it is something I will typically see. Really, when it comes down to it, turnover cost is how long is that role sitting empty and what is the impact it's having on everybody else? How much are you having to spend in overtime because that role is empty? How much loss of productivity are you losing because people are not able to do their job because they're having to do their job plus other people's jobs, even if there isn't overtime connected with it? How much time is having to be spent by a HR team to find and fill that new role? What about the interview team that is having to take time off their day to participate in this? Obviously, the ongoing costs for onboarding and redoing all of the onboarding documentation, the background check, the screening, the the drug screening, any of the paperwork side of it that you have to do. And then you add in the cost if you factor in employment branding and what you spend annually. For me, when we're looking at the costs overall, the cost per hire, I think the most valid way to do this is actually look at the entire spend for the talent acquisition department and divide that by certain roles. And then if there are any special costs, so agency fees or anything that is specific to a role, then you add that in on top of it. But the impact employment branding is having now is across the board, and so we can't discount the costs of that any longer, which we would normally do. The consistency and industry standard, though, truly is across the board. I just read in a recent research that came out, a nursing study for 2017, that the average cost to replace one nurse is upwards of $70,000. And again, that is clearly not based on just the cost per hire, but the impact it's having on the floor, the impact to engagement, the impact on patients and patient satisfaction scores, which impacts reimbursements. So depending really on what information your organization can get from a valid data perspective is how I would come up with a consistent turnover measurement that makes sense for you. Excellent. And do we have any other questions, Sophie, that have come in on your side?
No questions have come in directly to me.
Okay. One other thing that has just popped through. You know, my area of focus is on talent acquisition, but you know, I cannot stress the importance of really having that unified talent management front and making sure that if you truly want to have a really strong strategic retention effort going in, that you are looking at your ongoing learning and training programs, that you're looking at performance management and how you manage ongoing performance and engagement, that you're looking at your succession planning and your talent pathing opportunities for people within your organization, that you're doing these surveys and that you are really kind of connecting the dots, because it really is all inclusive, and more we're finding the impact of having these all separated out and not together versus having them together. Another question that just popped through. What is the ratio of cost for hire and retention versus training and internal promotions? There's a couple of different stats. So the question is it more expensive to hire somebody new or to internally promote and train? So there's a number of stats that float around on this. This is definitely an area that we are seeing a ton of research starting to take place and come hold in. The challenge when you're factoring the cost is what you're using for, you know, training and internal promotions. Some people will go all the way back and factor in every amount of training that person has ever had, which can definitely add up differently. Most of the research will say that it is anywhere between 5 upwards to 25 times more expensive to hire somebody new versus just training and internally promoting somebody. And the reason being is that the impact on retention and engagement are directly impacted. If they constantly see people leaving, and you have an organization where if somebody wants a promotion, they have to go, you become a short-term location and a short-term destination for anybody coming in, because that becomes your reputation. There are some companies that are totally okay with that, and that's their model. And so they hire, develop, and grow with the model in mind that they plan on people leaving after 2 years. They don't ever plan to do these type of promotions and growth. And you have another business model or strategy in place at other organizations where the goal is ideally to keep people as long as possible, because as they stay longer, they better understand your business, your clients, or your patients. They understand the nuance of your culture. They keep your culture consistent. There's some real strength in consistency, and it's not that one is right and one is wrong, but it's really important to know what your strategic goal is as an organization. If you are a temp type employer where your expectation is people are going to leave, if your desire really is to keep longer term. The more you have to hire replacements or hire people in new, the more you're going to have to hire overall. The consensus now for candidates is you find more and more are asking, why is this opportunity open? And the desire, right, for them is that it's open because of new opportunity. When we go back again and look at why people leave, it's for lack of advancement. And so our best people will get paid more and get better opportunity by becoming job hoppers or switching often. And I do not see any other questions that has come through. My email address is on here. Please do not hesitate if there was something specific that you think of later and you didn't have a chance to get through or you didn't want to ask it in a public forum. Please don't hesitate just to shoot me over an email, and we can always schedule some time to have some offline conversations about specifically what's going on within your organization.
Sarah, do we have time for one more question?
Yeah, absolutely.
All right, we have one that came in. Where do you start with creating a culture in the workplace?
Oh, that's a big one.
Yeah.
I think there's two sides of that question. And so the first goes back to some of the stuff that I talked about earlier, is if you want to create a culture, it's really challenging. You know, it's like saying, man, I would like to create a new personality. It's a very challenging thing to do because you have a culture that exists already. And so the easier way to do this, and the one that's actually going to be more authentic, get better buy-in, actually last long term, is to, one, set a goal that says, you know, here's what I wish our culture looked like. If I could do a dream culture, this is what it would look like. Second step is really do an assessment of our culture now. And much like the employee satisfaction surveys, I obviously come from a research background. I'm a huge data nerd and numbers geek. So I'm big on the surveys because I think it gives us so much valuable information. If we want to really make change and get executive leadership buy-in to be able to get the money to make change, we have to be able to talk in the same language they do. And finance and executives, they talk in numbers. And we need to be able to go in and show the impact of why these numbers are important. And so it's taking a look at where we have that gap now. What is our current culture? What is our dream culture? Where is the gap? And what is stopping us from getting from one to the other? Typically, a realistic culture is going to fall somewhere in between those two. But we have to really understand why our culture is the way it is. And that's why I think surveying is so important. Asking every single employee, you know, what do you like? What do you not like? How can we fix this? Sometimes the best ideas are going to come from the people that you would least expect it because they're watching and they're seeing and they don't always feel like they deserve the voice to be able to speak up and say, hey, if we did this, it would probably make the employees happier or it would make our patients happier. And so Getting their buy-in, getting their feedback is really, really key, but also just understanding kind of what the gaps are and why the gaps are there. So at a very early starting point, that's really where it is. And getting buy-in. Once you've identified kind of here's my dream, what I think the culture should be, and then understanding where the culture actually is, and then asking your employees where should it be, which is probably going to be somewhere between your dream and reality, and then getting their buy-in on how can we do this. It shouldn't be okay, we're changing culture. It should be starting to change, make little changes that are going to have a big impact. And slowly a culture is going to change. I have seen companies do like a rollout and it's like, we have a new culture as of today. This is our new culture. And it doesn't always come off nearly as authentic as when I've seen companies do it incredibly strategically, where it's little by little, things just change. It's, definitely more about putting actions before words. And as they see things, you then start seeing the brand and how we talk about our employees and our team members and how we talk about our patients changes and how we talk about our company changes and how we talk about our goals change. And slowly, little by little, the company will shift and change. If you have not, if culture is an issue for you guys at all as an organization, and actually if retention, if anything, is an issue, and you have not gone on Glassdoor, I cannot tell you like the urgency I have in my heart for you to get on Glassdoor and truly understand what people think about what it's like to work there. It is a very humbling experience sometimes to read what people have to say about your organization. And sometimes it's humbling because you are so honored as an HR team that you've been able to lead and develop a culture that people love so much. And other times it's humbling because you turn to it and you realize it's not at all what you had hoped and desired for the employees to have. And so the key is to read it with an open heart and an open mind and understand that, for the most part, they're just trying to be honest, and this is how they would talk if somebody else asked them. And so if you're looking at engagement, you're looking at retention, you're looking at employee satisfaction, if you're looking at any of these areas, it's really key to get on there and truly understand what people are already thinking about your organization.
Okay, so we are at the top of the hour. I want to thank you all for joining us today, and I would like to thank Sarah for sharing your valuable insights throughout today and the entire series. We hope you enjoyed the presentations. If you've missed the first two of the series, you can catch them on the Cornerstone YouTube channel. The link will also be made available in the follow-up email once this recording is available. Ladies and gentlemen, this concludes our webinar. You may now disconnect.